T cells do not secrete antibodies but helps B cell to secrete them. During infection, T cells interact with B cells. Each antibody molecule's Ig has 4 peptide chains. In antibody, 2 chains are small called light chains and 2 chains are longer called heavy chains. So antibody is represented by H2L2. Antibodies are Y-shaped. S is required to maintain the structure of immunoglobulins. Different types of antibodies are IgG, IgA, IgM, IgD, IgE, gamma day. 5 classes of antibodies. Abundance: G greater than A greater than M greater than D greater than E. IgE, IgE, G and IgD are monomers. IgA is dimer while IgM is a pentamer. IgG is most abundant 80% while IgE is the least abundant antibody. IgG can cross the placental barrier. IgG is found in serum. IgA is found in colostrum, saliva and tear, etc. IgA constitutes the largest percentage in human milk. IgA is the first antibody type which is formed in the human body at the age of 3 months. IgM has the highest molecular weight and is largest in size and is produced in primary immune response. IgM and IgG causes lysis of foreign cells. IgE mediates in allergic reactions. IgE also triggers inflammatory responses. IgE provides immunity to digestive tract against antigens. Antigen's binding site is present on N-terminal of peptide chain. Antigen binding site is an antibody is found between variable chains, a variable region of one heavy and one light chain. Binding of antigen to antibodies is through electrostatic interactions. There are 4 variable regions are present in an antibody molecule. Since antibodies are present in blood, the response is called humoral immune response. The term HUMOR in humoral immunity response implies plasma and beta lymphocyte or plasma cells mediates humoral immune response or antibody mediated response. T lymphocytes mediate cell mediated immunity (CMI). Killer T cells cause pore formation and antigen. T lymphocytes recognizes recurring molecular groups. When heart, liver and kidney and eye fail to function satisfactorily, the transplantation is the only remedy to enable the patients to live a normal life. Tissue matching and blood group matching are essential before undertaking any graft or transplant, and even after this the patient has to take immunosuppressants all his life. Body is able to differentiate self and non-self. Cell-mediated immune response or T lymphocytes is responsible for the graft rejection, like grafted kidneys. Rejection of transplanted organ is due to cytotoxic Body is able to differentiate self and non-self. Cell-mediated immune response or T lymphocytes is responsible for the graft injection, like grafted kidneys. Rejection of transplanted organs is due to cytotoxic T cells. An obstacle to large-scale transplantation of organs is immunological rejection of foreign bodies. Types of organ transplantation: autograft. Graft is the own body tissue. Example: skin graft. Autograft has lower risk of rejection, so it is the most successful transplantation. Isograft. Graft is from twins. Allograft. Graft from the individual of same species. Xenograft. Graft from the individuals of other species. Best HLA human leukocyte antigen match for transplantation is twin, greater than siblings, greater than parent, greater than unrelated donor. HLA is a group of genes. Monoclonal antibodies. Spleen cells of mice produce antibodies against antigen injected into the body. Cells obtained from cancerous tumors are known as myelomas. Spleen cells are mixed with myelomas cells which fuse together and form from hybrid cells. Hybrid cells divide to form clones called hybridomas. The selected hybridomas are cultured to produce large quantities of monoclonal antibodies. The method of production of monoclonal antibodies is called hybridoma technology. Cultured myeloma cells, antibody-producing cells, fusion, hybrid cells, cloning, hybridoma cells producing monoclonal antibodies. Hybridoma technology was developed by Kohler and Milston and got Nobel Prize for Medicine in 1984. Types of acquired immunity. Acquired immunity is of 2 types: active immunity and passive immunity. Active immunity is produced by after injections. Antibodies are produced in the host due to exposure of antigens, living or dead microbes or the proteins. This type of immunity is called active immunity. It is long-lasting immunity. Active immunity is slow and takes time to give its full effective response. Active immunity may be natural or artificial. Like natural active immunity, it arises due to the clinical infections. Persons recovered from the attack of measles, mumps, smallpox or chickenpox develops natural active immunity. Injecting the microbes deliberately during immunization induce active immunity. Infectious organisms gaining access into body during natural infection induce active immunity. Artificial active immunity, it is produced by introduction of vaccines. Passive immunity, when ready-made antibodies are directly given to protect the body against foreign agents, it is called passive immunity. Passive immunity is short-lived. Passive immunity is of 2 types: natural passive immunity. This immunity is provided by mother to fetus by transfer of antibodies through placenta. Colostrum, yellowish fluid, is secreted by mothers during the initial day. Colostrum, yellowish fluid, is secreted by mother during the initial days of lactation, has abundant antibodies IgA to protect the infant. This is one example of a passive immunity. Short-term immunity is provided by colostrum. Fetus receives some antibodies from their mother through placenta during pregnancy. This is an example of passive immunity. An artificial passive immunity, it is ready-made antibodies. Preformed antibodies are transferred to the body of individual. Example: anti-tetanus serum (ATS) is used for passive immunization against tetanus. Anti-serum has antibody. Treatment of snake bite by antivenom is providing artificially acquired passive immunity. autoimmunity. If a person is injected with gamma globulin against hepatitis B, it is called artificially acquired passive immunity. Vaccination and immunization. Principle of immunization or vaccination is based on the property of memory of the immune system. In vaccination, a preparation of antigenic proteins or pathogens or inactivated weakened pathogens, vaccine are introduced into the body. Vaccine is the suspension of attenuated pathogens that stimulated formation of antibody. Vaccine is a suspension of attenuated pathogens that stimulated formation of antibody. Vaccination protects a person from disease because it produces antibody. Antibodies produced in body against these antigens would neutralize the pathogenic agents during actual infection. Vaccines also generate memory B and T cells that recognize the pathogens quickly on subsequent exposure and overwhelm the invaders with a massive production of antibodies. In case of tetanus, quick immune response is required. We need to directly inject the preformed antibodies or antitoxin, a preparation containing antibodies to the toxin, passive immunization. In case of snake bites, the injection which is given to the patients contains preformed antibodies against the snake venom. This type of immunization is called passive immunization. The recombinant DNA technology has allowed the production of antigenic polypeptides of pathogen in bacteria or yeast. Vaccines produced using this approach allow large-scale production and hence greater availability for immunization. Large number of infectious diseases like polio, pneumonia, tetanus, and diphtheria have been controlled to a large extent by use of vaccines. Biotech is at the verge of making available newer and safer vaccines. Types of vaccines. Vaccines are classified into three types. First generation vaccines, attenuated live vaccines, smallpox vaccines of Jenner. Killed vaccines, harmless viruses, SARS poliovirus. Second generation vaccines. These are formed by genetic engineering or RNA techniques. Vaccines produced through genetic engineering are safe as they contain antigen only from a coat of pathogen. Example, hepatitis B vaccine produced from yeast. Third generation vaccines. These are synthetic vaccines which are purest. Allergy, a non-infectious, unnatural and unusual reaction to a substance or a condition is called allergy, or excessive and inappropriate immune response to an antigen is called allergy. Or allergy is the hypersensitivity of a person due to certain foreign agents present in environment. Exaggerated, aberrant functioning response to toxins produced by tetanus affects voluntary muscles of the immune system to certain antigens present in environment is called allergy. Substances which produce immune responses are called allergens. Antibodies produced to these allergens are of IgE type. Most common example of allergens are mites in dust, pollens, Parthenium, carrot glass, animal dander. Symptoms of allergic reactions: sneezing, watery eyes, running nose, difficulty in breathing. Allergy is due to the release of chemicals like histamine and serotonin from the mast cells. Histamine is also secreted by connective tissue. Shock organ of allergy is spleen. Inflammation is also caused due to kinins and prostaglandins. Histamine causes vasodilation of peripheral blood vessels. Anti-allergic drugs like antihistamine, adrenaline, steroids quickly reduce the symptoms of allergy. Somehow, modern-day lifestyle has resulted in lowering the immunity and more sensitivity to allergens. More and more children in metro cities of India suffer from allergies due to asthma due to sensitivity to environment. This could be because the protected environment provided early in life. Hay fever and asthma are the allergic conditions. Autoimmunity, memory-based acquired immunity evolved in higher vertebrates based on the ability to differentiate foreign organisms. An example, pathogens from cells. Sometimes body attacks own cells due to genetic or other unknown reasons and results in damage of body, and this is called autoimmune disease. Rheumatoid arthritis, myasthenia gravis, Hashimoto's disease, Graves' disease, pernicious anemia. Immune system in the body. Human immune system consists of lymphoid organs, tissues, cells, and soluble molecules like antibodies. Immune system recognizes foreign antigens, responds to these, and remembers them. Immune system plays an important role in allergic reactions, autoimmune diseases, and organ transplantation. Lymphoid organs are organs where origin and or maturation and proliferation of lymphocytes occur. Lymphoid organs are of two types: primary lymphoid organs, secondary lymphoid organs. Lymph nodes, thymus, lymphatic vessels. Primary lymphoid organs. Primary lymphoid organs are bone marrow and thymus. Bone marrow is main lymphoid organ where all blood cells including lymphocytes are produced. Lymphocytes are units of immune system which causes destruction of bacteria. Thymus is a lobed organ located near the heart and beneath the breastbone, sternum. Thymus is quite large at the time of birth, keep reducing in size with age, and by time of puberty is attained it reduces to a very small size. Both bone marrow and thymus provides microenvironments for the development of and maturation of T lymphocytes. Both B and T cells are produced in bone marrow. Thymosin helps in differentiation of cells of immune system. The letter T is the T lymphocytes refers to thymus. Bursa fabricans of birds is associated with generation of B cells. T lymphocytes mature in thymus. Damage to thymus in a child would lead to loss of CMI. In primary lymphoid organs, immature lymphocytes differentiate into antigen-sensitive lymphocytes. Secondary lymphoid organs. After maturation, the lymphocytes migrate to secondary lymphoid organs. Secondary lymphoid organs provide the sites for interaction of lymphocytes with antigen, which then proliferate to become effector cells. Example: spleen, lymph nodes, tonsils, Peyer's patches, or small intestine appendix. Spleen is a large bean-shaped organ. Spleen is the largest lymphoid organ of the body. Spleen contains lymphocytes and phagocytes. Spleen acts as a filter for the blood by trapping blood-borne microorganisms. Spleen also helps large reservoir of erythrocytes. Lymph nodes are small solid structures located at different points among the lymphatic system. Lymph nodes trap the microorganisms or other antigens which happen to get into the lymph and tissue fluid. Antigens trapped in the lymph nodes are responsible for the activation of lymphocytes present there and cause the immune response. MALT, the lymphoid tissues located within the lining of major tract, urogenital, digestive and respiratory, URG, called mucosal associated lymphoid tissue. BAL constitutes about 50% of the lymphoid tissue in the human body. A person stung with bee is administered penicillin. The person may die due to anaphylactic shock. Neutrophils secrete cytokinins, attracting neutrophils, eosinophils, monocytes, and dilating capillaries. Neutrophils secrete cytokinins for attracting neutrophils, eosinophils, monocytes, and dilating capillary. In anaphylactic shock, histamines dilates blood vessels. Drug abuse. Commonly abused drugs are opioids, cannabinoids, and Cox alkaloids. Majority of these obtained from flowering plants. Some are obtained from fungi. Several plants, fruits, and seeds having hallucinogenic properties have been used for hundreds of years in the folk medicine, religion ceremonies, and rituals all over the globe. When these are taken for a purpose other than medicinal use or in amounts, frequencies that impairs one's physiological, and psychological functions, it constitutes drug abuse. 1. Opioids. Morphine is extracted from latex of coffee plant, Papaver somniferum, from unripe fruit. Papaver belongs to the family Papaver. Heroin is obtained by acetylation of morphine. Heroin is chemically diacetylmorphine. Heroin is commonly called smack or brown sugar. Brown sugar is diacetylmorphine hydrochloride. Heroin is white, colorless, bitter crystalline compound. Opioids are generally taken by snorting and injection. Opioid receptors are present in CNS and GIT. Heroin is a depressant and slows down body function. Morphine is very effective sedative and painkiller, and it is very useful in patients who have undergone surgery. Opioids are also called narcotic chemicals with sleep-inducing properties. Sedatives and tranquilizers are also called depressants. Opioids lead to constriction of pupil, slowing pulse and respiration. Naloxone or nalomorphine is used as antidote intravenously for overdose of morphine. Codeine is a derivative of opium, methylmorphine. It does not cause addiction and used as medicine in cough syrups. Cannabinoids. Natural cannabinoids are obtained from inflorescences of plants. Cannabis sativa, hemp plant. The flower tops, leaves, and resins of cannabis plants are used in various combinations to produce marijuana, hashish, charas, and ganja. Cannabinoids. Heroin is a depressant and slows down body functions. Morphine is a very effective sedative and painkiller, and it is very useful in patients who have undergone surgery. Opioids are also called narcotics, chemicals with sleep-inducing properties. Sedatives and tranquilizers are also called depressants. Opioids leads to constriction of pupil, slowing pulses and respiration. Naloxone or nalorphine is used as antidote intravenously for overdose of morphine. Codeine is a derivative of opium. It does not cause addiction and used as medicines and cough syrups. Cannabinoids. Natural cannabinoids are obtained from inflorescences of plant cannabis sativa. The flower tops, leaves, and resins cannabis plants are used as various combinations to produce marijuana, hashish, charas, and ganja. Cannabinoids taken by inhalation or oral ingestion. Cannabinoid receptors present principally in the brain. Cannabinoids effects on cardiovascular system of the body. Ingestion of cannabis products, marijuana or ganja, leads to illusion, altering thoughts, feeling, and perceptions. So it is hallucinogen. These days, cannabinoids are also being abused by some sportspersons. Cox Alkaloids. Coca alkaloid or cocaine is obtained from coca plant Erythroxylon coca, native to South America. Cocaine is commonly called coke or crack, is usually snorted. Cocaine interferes with the transport of the neurotransmitter dopamine. Cocaine has a potent stimulating action on CNS. Cocaine produces sense of euphoria, increased energy. Excessive doses of cocaine causes hallucination. Datura and Atropha belladonna also have hallucinogenic properties. Amanita muscaria is a fungi which produces hallucinogens. Hallucinogens causes dreamy of state of unconsciousness. Drugs used to treat mental illness like depression and insomnia, amphetamines, barbiturates, benzodiazepines are often abused. Drugs used to treat mental illness like depression and insomnia. Caffeine is an alkaloid obtained from seeds of coffee plant Caffeia arabica. Coffee originated in Africa. Coffee and tea are non-alcoholic beverages. Caffeine, cocaine, and amphetamine are stimulants. Amphetamine is commonly called Superman. Amphetamines are synthetic drugs which are structurally related to adrenaline. Aspirin is a tranquilizer, hypotensive and giving soothing effect. Valium causes feeling of calmness, relaxation, drowsiness, and depressed brain activity. A person showing unpredictable moods, outbursts of emotion, quarrelsome behavior, and conflicts with others, suffering from BPD, borderline personality disorder. Tobacco. Tobacco has been used by human beings for more than 400 years. Tobacco contains a large number of chemical substances including nicotine and alkaloid. Morphine, cocaine, codeine, and nicotine are all alkaloids. Nicotine stimulates the adrenal glands to release adrenaline and non-adrenaline, both of which raise blood pressure and increase heart rate. Smoking is associated with increased incidence of cancer of lungs, cancer of urinary bladder, cancer of throat, bronchitis, emphysema, coronary heart disease, gastric ulcer. Tobacco chewing is associated with increased risk of cancer of the oral cavity, mouth, and cancer. Smoking increases CO content in blood and reduces the concentration of hemobound oxygen, which causes oxygen deficiency in the body. In BD, tobacco is wrapped in leaves of tendu plant, Diaphorus melanoxylon. World No Tobacco Day is 31st May. Addiction. Because of perceived benefits, drugs are frequently used repeatedly. The most important thing which one fails to realize is the inherent addictive nature of the alcohols and drugs. Addiction is a psychological attachment to certain effects such as euphoria and temporary feeling of well-being associated with drugs and alcohol. These drive people to take them even when these are not needed or even when they are become self-destructive. With repeated use of drugs, the tolerance level of the receptor present in the body increases. Consequently, the receptors respond only to higher doses of drugs or alcohol, leading to greater intake of an addiction. However, it should be clearly borne in mindset the use of these drugs, even once, can be a forerunner to addiction. Thus, the addictive potential of drugs and alcohols pulls the user into a vicious circle, leading to the regular use for which he or she, in the absence of guidance or counseling, the person may be addicted to sometimes on their use. There may be even some far-reaching implications of drug alcohol abuse. If a abuser is unable to get money or drugs, alcohols, he or she may turn to stealing. The adverse effects are not just restricted to the person who is using drugs or alcohol. At times, a drug alcohol addict becomes the cause of mental and financial distress to his or her family. Those who take drugs intravenously, direct injection into the vein using a needle and syringe, are much more likely to acquire serious infections like AIDS and hepatitis B. The viruses which are responsible for these diseases are transferred from one person to another by sharing the infected needles and syringes. AIDS and hepatitis B can be transmitted to one's life partner through sexual contact and through infected blood. The use of alcohol during adolescence may also have long-term effects. It could lead to heavy drinking in adulthood. The use of drugs and alcohol during pregnancy is also known to adversely affect the fetus. Chronic use of drugs and alcohol damages nervous system and liver. Cirrhosis. Cirrhosis of liver means shrinkage and fibrosis of liver. In alcoholics, livers get damaged due to accumulation of fatty liver syndrome. In liver, alcohol is converted into a more toxic substance called acetaldehyde. Cerebellum part of brain is first most affected by alcohol. Alcohol causes impairment of coordination of limbs because it affects cerebellum. Alcohol affects mental function as it crosses BBB, blood-brain barrier. Alcohol affects vision. Vision becomes blurred and the field of vision is reduced called tunnel vision. Alcohol causes diuresis, increased urine output. Dysomania is severe addiction to alcohol. Another misuse of drugs is what certain sportspersons do to enhance their performance. They misuse narcotics, analgesics, anabolic steroids, diuretics, and certain hormones in sports to increase muscle strength and bulk and to promote aggressiveness, and as a result increase athletic performance. Side effects of use of anabolic steroids in female: masculinization, increased aggressiveness, mood swings, depression, abnormal menstrual cycle, and enlargement of clitoris, deepening of voice, excessive hair on growth and face body. Side effects of use of anabolic steroids in male: acne, increased aggressiveness, mood swings, depression, reduction of size of testicles, decreased sperm production, kidney and liver dysfunction, breast enlargement, premature baldness, enlargement of prostate gland. These effects may be permanent with prolonged use. In adolescent male or female, severe facial and body ache, premature closure and growth center of the long bone may result in stunted growth.